Many beds that we provide, such as this one, which is a Hannah, come with padding. It's optional, and the padding can be individually prescribed for each user. So the options you would consider is, firstly, how high do you want the padding to be? Usually the choice would be 2/3 or full height. The next choice would be whether or not you actually want windows in the padding. Now these are very important because these allow visual access both ways. The person in the bed can see out and you can see in to make sure everything is okay. The windows are actually built into the padding, and I have an actual example of a window here. So as you can see, the window is double glazed. There is a pocket of air and the surface is soft. So the window is actually a continuation of the padding, allowing you to look through. There are two choices of window, a soft vinyl or a macrolon. Now on this video they look the same. The advantages of the macrolon are that they can be bigger because this material does not stretch. Padding is mostly bolted onto the bed, and we can see that here. These are points at which the padding is secured to the bed. So if the padding needs to be removed occasionally, with an Allen key you can undo these fixings and remove the individual piece of padding from the bed. There is also an option for Velcro fixing, but we are very seldomly asked to do that. There are potential considerations with infection control, and also it would be possible for the person in the bed to potentially pull Velcro fixed padding off from the inside. Now, you cannot do that with bolted padding, so bolted padding is our first choice and what we would always recommend, unless there is a good reason to look at Velcro as the alternative. The materials that we use for padding these days are mostly chieftain. So chieftain is a tactile, soft vinyl. It makes it very easy for keeping clean. For some users, there are additional considerations to think about. You may have somebody that can bite or pick or tear, and this may actually be a behavioural linked concern that's not going to go away. In which cases, we would look at an alternative material, such as a ripstop material, and there are several to choose from, again in a whole range of colours. The ripstop is a string reinforcement moulded into the material, which means although it could be punctured, the actual puncture cannot develop into a tear. As I said, each cot is individually prescribed with padding. You can have colours of your choice, any combination of colours of your choice, and you can also have top edge padding which would go up and over the top edge. This is often referred to as chin padding. So that's an overview of what's possible with padding. Basically, anything is possible. If you ask, the answer is always going to be yes. We can make bespoke padding solutions for very complex situations if needed. But in summary, what we have is a way of fixing padding that is secure, cannot be pulled off from the inside, with the added advantage of being able to safely observe from a distance, and also giving the person in the bed an opportunity to see out. Thank you.